am the president of LiveWell Behaioral Health and also a licensed psychologist. So for me, it's a privilege to be here to be able to talk to you guys. And what we're dealing with is a super intense problem for our entire community. This is a hard workshop to walk into, right? Because it denotes like the idea that, man, there's stuff going on with my kid, and what do I do about it? So we're just glad those of you that are here because it's hard to walk in. We're glad those of you that are watching online are watching online, because we just want to get this information out, and we want to get it out in a relevant way. So my goal today is to just give you some brief information about what's going on with marijuana. A lot has changed with marijuana in the past few years. In a minute, Dr. Medali is going to join me, and we're just going to have a conversation about what happens in the brain and the body with marijuana, especially in adolescents. And then Miss Alana Sadhu, who is our Director of Clinical Programming here at LiveWell, is going to kind of wrap everything up with just some ideas about what you do next. Like, what do you do if your kid is struggling, or what do you do if one of your students is struggling? What do you do if somebody that you're coaching is struggling? How do we get them help? So with that, I will just start us off here. Marijuana has been around for a long time, right? I think that's part is clear. We've called it all kinds of things. When I was growing up, it was reefer or bud or weed or Mary Jane. Mary Jane's a little bit before me, but I hear they called it Mary Jane. Alana says, sure. Thanks, Alana. But although it's been here throughout the generations, there's been this mindset for people over the years that adolescents are just going to try it. Like, just this certainty. It's just a rite of passage, per se. Some people think that it's kind of normal for adolescents to actually smoke marijuana just regularly or consistently. I have people in the clinical office all the time, and I hear this kind of thing. Kids will be kids, right? I mean, I hear that over and over and over. Kids will be kids. And when I hear that in family therapy, I know that we're starting down a road with this family where kind of the idea of marijuana is normal for adolescents is part of the issue that we're going to have to break through in order to get some momentum. And I guess culturally for me, one of the difficult parts is I feel like it's become a cultural norm that as a group, our culture is driving the idea that this is something that is going to be accepted and maybe even celebrated. If you listen to music, like any of the kids' music, it is an understatement to say it is celebrated. It is more than celebrated. It is condoned as just kind of part of their life and part of their culture. So we've got that mentality on one side, and then we've got sort of the other side of the coin. Because the reality is marijuana is a problem. Like, I'm just going to tell you my bias in this is that marijuana is a problem for teens in particular. And so you'll hear kids will be kids and it's no big deal. But then you've got this other piece where you've got professionals, parents, educators, coaches, anybody in leadership with kids, and we're seeing kids compulse on marijuana. I mean, just be compulsive with it. When I was growing up, it wasn't unusual. I grew up here in Brevard County, by the way. I'm one of the natives. I moved away for a decade, but we came back to Brevard, and so I was a proud Merritt Island Mustang growing up, I can say. Go Mustangs. And it wasn't unusual at all for kids to be like, we're gonna smoke weed, but it was not very often that a kid was like, wake and bake is what I call it now. Like, wake up and smoke. And so that's what they do. They wake up and they smoke. And they need to smoke to eat breakfast. And then they go to school and they smoke in the bathrooms. My son told me the other day, this was like a fascinating story. He said, so I figured out when to go to the bathroom and when not. I was like, oh, this is good. I don't know where this is going. And he said, I know that if I see a group of people like going to the bathroom, like 3 or 4 of my buddies are going to the bathroom at the same time, he said, I don't go in the bathroom anytime I was like, why? He said, because they're smoking. He said, I don't want to get in trouble because I'm in there. And I was like, well, that's probably true because guys don't go to the bathroom together. Girls go to the bathroom together. Guys don't go to the bathroom together. So they're smoking all day at school, and then they go home and they smoke, and then they smoke to go to sleep. We have clients in our program at the clinic that consistently have to smoke marijuana in order to get to sleep. So I'll tell you a lot more about how this is possible, but it is something that they're doing in a much more compulsive way than any other generation in history. So here's the scary part. So you've got all of that going on. These kids are just obsessing over it. But the research shows that suicide, depression, anxiety, and a plethora of other mental health issues seem to coincide with this chronic use of marijuana in some adolescents. So it's become such an issue for us clinically that we've had to like literally start programs to try to address this in the life of kids and families. So we have a program in our office. This is all we do is work with kids that are struggling with this, because the old come to family therapy and come once a week just doesn't seem to touch this in their life, and it doesn't seem to be enough to get them over the hump. So what's the real story behind marijuana? Is it something that we need to be concerned about, or is it no big deal, kids will be kids? Our bias, and we just want to be real clear about this, it's a problem. So why? I guess the biggest thing for us, I'm going to stand because that bench is driving me crazy. The biggest thing for us is to start with how marijuana is different. It's a different substance now than it was years ago. So there are people that went to Woodstock, right? So if you talk to somebody that went to the big music festivals back in the 60s, they're gonna say it's impossible that this is that big of a problem. I smoked weed for years and it was really no big deal. And they're probably right, because the weed at Woodstock, for instance, was about 2, maybe 3% THC. THC is what is the substance in marijuana that creates the euphoria, creates the high, right? It's about 2 to 3% THC. You fast forward to about the mid-90s, and we started to see that the people growing marijuana, and at that point, at least our marijuana, none of it was like medical grade, grown by people in the US. It was coming from other places, a lot of it, and they were learning how to make the weed stronger and better. So by the mid-90s, that THC percentage was around 8%, give or take. Obviously, if you get some good stuff, it would be 10 or 12%, but average of about 8% THC by the mid-90s. This is fascinating for me. My family were citrus farmers in North Merritt Island. Like I grew up in orange groves, so to know that like all the thought was put into how to develop this to make it stronger is wild. Now here's where it gets scary. So you got 2 to 3% in Woodstock. You got 8% when I graduated high school. Now the THC content in a lot of the popular strands of marijuana grown in Colorado or California is around 25, 27% THC. So the bud, like the actual flower, is much, much stronger. And then that's compounded by vapes. So you've got these vape pens, or what your kids call a dab pen, and a dab pen is just like a vape pen that you would smoke nicotine out of or whatever, but it's got THC oil in it. Some of those dab pens have as much as 95% THC. It's a totally different substance than it was at Woodstock. And Dr. Medali will speak to this in a little bit, but you know, the way I think about it, and this is not like a medical certainty, this is just like the metaphor that I use for myself to think about it. You start taking, like if I took a hit off of a 95% THC dab pen right now, I'd probably pass out. Like, you know, it would be super strong. It's almost like just a little hit of a psychedelic. Like there's this little psychedelic quality to it. And that's how these kids are getting so compulsive, so addicted. That's why they're struggling so much.
Dr. Mike, not to mention that sometimes the kids that use the vape pens, they lace it with other illicit substances, which magnifies the potency.
So I have an example about that. So Miss Sadhu has brought to the table the idea that some of the vape pens, they're smoking weed, like THC, right? This is my dab pen. What they might or might not know is that a lot of people making these pens, these weed vapes, are putting a bunch of other chemicals in it, a bunch of other chemicals. I was talking to a kid just the other day, this kid was maybe 14, and he said, yeah, well, I ended up smoking weed. And I was like, okay, what did you smoke? He said, well, I smoked, let me see if I can remember what he called it. I smoked a Mario Kart. That's what he called it. I smoked a Mario Kart. I was like, what's a Mario Kart? He said, you know, like I would know. It's the vape pen that has it's got Mario and Luigi on it. It's I'm like, okay. So, bro, I said to him, think about what you're telling. You ingested something that had Mario and Luigi on it. Do you think that Nintendo endorsed this and they were a part of? Well, no, probably. Okay, so what you're saying is it's some dude in China, or in Miami or Chicago, that created this, put their own branding on it, and you mean to tell me that you think it's only THC in there? Because he had a weird reaction. He smoked it at school and he had a paranoid event. Like he was off the rails for about an hour. So that's what our kids are dealing with. So they are not even smoking what they think they're smoking when they think they're smoking it. A little bit of an aside, but ecstasy is a big problem as well. Ecstasy is not even MDMA anymore. Some of the ecstasy that comes from China is MDMA plus like 170 chemicals. That's a real number. Like it was 170 different chemicals in the ecstasy that the kids were taking. Fentanyl is a big problem too. I have not heard of fentanyl in a vape pen. You guys might have. Alana has heard of fentanyl in a vape pen. So they'll put fentanyl in just to give the kid like this amazing high, right? Because they're smoking weed, but they're not smoking weed now. They're doing opiates. Fentanyl is incredibly dangerous, and it's what causes most of the overdoses that we're dealing with and seeing, the explosion of overdoses in the past decade. So marijuana is not marijuana. That's the bottom line there. It's a different substance than it used to be. So what is this doing to our kids? What are the consequences? By all accounts, because of the power of the pens and the power of maybe a fentanyl laced dab pen, it's creating. Let's start with cognitive problems in our kids. So the hippocampus is the part of the brain that is important for new learning and for memory, right? So the hippocampus is negatively impacted by the chronic use of any addictive substance. So it really doesn't matter, especially for an adolescent. It could be alcohol or cocaine, but especially marijuana. when you're smoking it chronically and it's in there all the time, it's going to affect the development of the hippocampus. That's especially true for adolescents. Why? Because an adolescent's brain is not developed. It's developing. It's in the process of developing. That brain is supposed to be a sponge, just like soaking in all this new information, all this new learning. And when you shut that down, that process down, by chronically having this substance in your brain that affects the hippocampus, you're negatively impacting their ability to build a solid base of knowledge. So how does that look in real life? Well, we've done the research. For kids that smoke chronically, there's a loss of IQ points. Some of the research shows as much as 8 points on an IQ test for a kid that smokes chronically. So just to do a little math here, the average IQ is 100, right? The standard deviation of IQ is about 15. So the standard difference, that you get in the bell curve. If you've got a kid that's smoking and he's now 8 points lower on the IQ test, that's half a standard deviation lower. So you took a kid with an average IQ of, let's say, 100, and now you got a kid with an IQ of 92. That's a big deal. That's the difference between I took algebra and I did well, and I took algebra and I'm struggling, to kind of remember the formulas. So I went from maybe my A or a B to a C or a D. It's significant. So that kind of drop in an adolescent is going to make them struggle more than they typically would keeping up academically. So you've got cognitive processes, you've got emotional dysregulation that comes as a result of the marijuana. So there's evidence to suggest that marijuana has a significantly negative effect on the developing amygdala. So that's the fear threat center of the brain. It's right in the back of the brain, next to the other regions of the brain that control really primitive things like heart rate, respiration, appetite. Like right there is the amygdala. And the amygdala has tons of these cannabinoid receptors, and it will be negatively affected with this marijuana in the system and in the brain over and over and over and over again. So because the amygdala is the fear threat control center of the brain, it makes that developing amygdala hypersensitive to fear threat. So these kids start to see fear and threat in lots of different areas of their life. Some researchers believe that the increase of anxiety in an adolescent marijuana user places that kid in a much, what they would call, more significant position to have a mood disorder later on in life. I can tell you this anecdotally, we work with lots of kids, and I have seen this over and over and over and over again. We'll have a 21-year-old come in for treatment, right? Kids in college, maybe senior in college or junior in college, anxiety off the hook, like not functioning, panic attacks in class, can't focus just an anxious mess, and it's not uncommon. It's just not uncommon. As we do the evaluation and we're trying to understand what's going on, we'll ask about previous drug use, and many times these kids will be, yeah, I was smoking weed heavily 14, 15, 16. So smoking weed heavily 14, 15, 16 can lead to 19, 20, 21 panic disorder. It's super sad, guys, because they don't know it's happening. They don't understand that it's happening. Here's some other things that I thought were worth mentioning. Marijuana use is correlated with symptoms of depression in adolescents. We can't show causation, but we can certainly show correlation. Girls who smoke marijuana at least once a week are twice as likely to develop depression than those who don't smoke at all. Once a week, twice as likely to have depression. Adolescent girls who use marijuana every day, you ready for this? 5 times as likely to suffer from depression and anxiety than a non-user. That's some tough statistics. That's tough. As a clinician, as a psychologist, that makes me want to like do something. I don't know what. Like go out and like get these people that are just selling it to the kids. Other studies have demonstrated that smoking weed prior to age 15 to 18 significantly increases the risk of developing psychotic symptoms later on in life. Dr. Madali can speak to that. Again, this is not a certainty. This doesn't happen in everybody, but it's like you're cracking the door to some of these issues later on in life. This is especially true for the high potency THC. So you think about the weed that was smoked in 1991, wasn't cracking the door near as wide as 95% THC smoked all day. I can't not say this. Some studies show a 7-fold increase in suicide attempts in daily marijuana users.
60% more chance of dropping out of high school or college.
60% greater chance of dropping out of high school or college. It takes motivation and it just like pulls it out of a kid. Like it just pulls it out of a kid. And so when you think about it, like if I smoke marijuana and I sit on my couch, that's all I need. I don't need anything else. They can smoke weed and just sit on the back porch and it's just like life is grand, right? Well, why are you going to matriculate through a college program or high school if it really doesn't mean anything? If it's not as good as sitting on the couch and all the dopamine that you're getting, that's why they drop out. Okay, so the idea that adolescent marijuana use, we might, oh, here we go, good, I thought we had messed it up again. The idea that it's harmless is just a joke. It's not harmless. And here's the big piece, is addiction. Years ago, in fact, when I was trained, the idea was marijuana is not addictive, marijuana is not addictive, marijuana is not addictive. That was not considering the high potency THCs, right? Dr. Madali can speak to this in a minute. Now, you can make a case marijuana can be physically addictive. You certainly can overdose on it. Ask people that go to Colorado to ski and they stop at the weed store to get their edible or in the ER about a few hours later. You can definitely overdose on it now. You're not going to die, but you can feel like you're going to die. But we're not even going to have the conversation about physical addiction. Let's just say maybe not. Let's just go with like the idea of emotional addiction. The emotional addiction to the new marijuana is staggering. We see kids in the office all the time, all day, every day, who are they're those wake and bake kids, and then what they do is they'll put their pen in their sleeve, in their hoodie, and they smoke all during class. I see a teacher, and I told her this the other day, and she said, I'm going to start looking for kids that, I said, yeah, just look for if they have their sleeve, up near their mouth all the time. They breathe it in, and then they breathe it back in the hoodie, right? So that and they smoke all during class. So one of the classic definitions of addiction means that a person has trouble controlling drug use even when it's causing negative consequences in their life. So without a doubt, you've got an epidemic of emotional addiction to marijuana when you have kids that are in trouble with their parents. They've lost everything that they have. They've lost their phone, they've lost their car, they've lost friends. Now their friends don't want to hang out anymore because they're doing weed all the time and they don't want to do it. They're failing in school, and what are they doing? Still jonesing for marijuana. That's like a hallmark characteristic of addiction. If you're still pursuing it when it's causing all these problems, that's an emotional addiction, period. I wanted to tell you guys.
Next slide. Keep going.
Oh, is it past that one? Okay, let me do this real real quick, and then we'll come back to just talk to you about what happens with addiction. It starts with negative emotion. So think about things like depression, anxiety, stress, pressure, hopelessness, whatever. Like I feel bad, right? And when you have like negative emotion, that leads to what I call the urgency to get rid of that emotion, right? So you call it trigger, right? Like I can't stand feeling like this. And then that urgency leads to behavior. Now the behavior can be a number of different things, right? It could be, for our kids, pornography, cell phones, video games, music, you know, it can be a number of different behaviors. And the issue is marijuana in particular, it's hard to find a better short-term fix. Like if you're feeling like I can't stand feeling like this, it's hard to find anything better than weed, right? Weed's awesome for 15 minutes, 20 minutes, an hour, right? Amazing. But the problem is that behavior, when you smoke weed, leads to consequences. And the consequences are emotional, relational, academic, family, all these consequences. And what do you think starts happening? This is the crazy part about addiction. What starts happening in the life of someone who's got all these consequences, all this stuff is happening? Now they've got more negative emotion. Now they're more depressed and more anxious, and now they have to get rid of it even more. And the weed's right there and it's easy, and then they have all the other consequences, and now they were arrested and kicked out of school, and now more and now they're swirling in this, and that's what addiction really is. So we're going to tell you what to do, but I wanted to lay the framework for people to know what we're dealing with. This is not like an easy little thing. Oh, let's go watch a video about, you know, why you should say no to drugs, and we'll get through this and we'll be fine. This is hard for our kids. It's hard for them to break out of these cycles. So having said that, I want to invite Dr. Medali up here to talk to me. We're gonna go over some questions. And Dr. Medali, you can we can just have a conversation together about it.
Yes.
And I think the first question is marijuana safer for kids than alcohol?
Okay.
Trevor, would it be good if I get on the other side of her? Is that better? Okay. So is it safer than alcohol?
So asking whether apples are better than oranges, that's probably not the question we should be asking. What we should be asking, what are the differences in the way alcohol or marijuana affect kids' brains? So from what we know, alcohol, we have a lot of information, a lot of data, because we have collected data about alcohol and effects of alcohol in adolescent brain for many, many, many years. Cannabis is more recent, and also, unfortunately, because cannabis was not approved by the FDA to study, we don't have as much data or as much information, although we are starting to do much more collection of data. There was a very large study in Canada which showed that cannabis use in adolescents can cause cognitive delay and cognitive problems. What they saw was most often they saw problems in attention span, memory, and also behavior. In alcohol, what we see is damage to what we call the gray matter in the brain. So our brains have two kinds of matters: gray matter, which is basically the neurons or the nerve cells, and white matter, which is the connective tissue around the brain cells. Now, we have a finite number of gray cells or brain cells when we are born. That's why when you're pregnant, you know, women are told not to do anything, because that's when actually your brain is developing, your neuronal tube is developing. But once you're born, your gray matter is a finite number of neurons. The only thing that happens is that you form connections between these brain cells as you're growing up. So once you become an adult, in men about 24, 25, you don't develop too many new connections. But in girls about 18, 19, you don't develop too many new connections, although you can still have some loss of neuronal connections if you use substances that damage, that are neurotoxic. So alcohol seems to damage more of the gray matter, which means that it causes loss of neurons. The cannabis seems to affect more of the white matter, which means that the connective tissue, the health of the brain, is affected. And what we see as a result is that you have problems with cognitive development in both, but it's slightly different in the way they present.
Wow. What was the age for, you said?
The Canadian study did it, the age was from 15 to 18, and this was more chronic use. This was, you know, almost daily use. Now, when you use high potency cannabis, there was slightly different. There was more effect on what we call the frontal brain, which, you know, has to do with, you know, decision making, judgment, reasoning, planning, and so when you use the high potency cannabis, there was more problems with the frontal brain, and they actually saw changes in the frontal brain. But low potency and a regular use of cannabis, we saw more generalized effect on the brain.
Crazy. So what's the connection between marijuana use, chronic marijuana use, and depression and anxiety?
Okay, so there's no direct evidence that cannabis causes depression, but what we know is that there's a lot of correlation, which means that kids who use cannabis are 7 times more likely to be depressed. And kids who are depressed are 7 times more likely to be using cannabis. So there's a relationship in that way. We don't know, there's no direct evidence that cannabis actually causes depression, but there's plenty of evidence that cannabis causes anxiety. And the more evidence we have about cannabis is about psychosis. How many more times you're likely to have psychosis if you use cannabis as an adolescent? 10 times more to develop some form of psychosis when you become an adult. Now, if you have a family history of some kind of psychiatric disorder, for example, bipolar disorder, schizophrenia, you're 50 times more likely to develop psychosis. So if you have a family history, you have to be so careful about using cannabis, especially in adolescents, developing brain. We don't know exactly how it damages the brain and what it does, and also for when adolescents don't have a family history of psychiatric disorders, why we also see an increased amount of psychosis, but there's direct correlation between cannabis use in adolescents and development of psychosis.
Wow, that's a shocking statistic. It's a staggering statistic. So you think about like what adolescents struggle with. They struggle with looking beyond today, right? Like, yeah, I've got 3 adolescents right now in my house. They struggle beyond like right here, right now, but the stakes are so high.
So yeah. That's why I think, you know, educating them, information, and parents knowing this, I think is so important. Yeah.
It goes back to like the whole thing, kids will be kids. We just can't do that anymore. We can't take that attitude anymore.
So it's actually damaging their brain.
Yeah, it's incredible. All right, let's get back to, I think it's our last question, because the paranoia, I think, is what we just looked at, which is staggering.
Right.
Do you typically prescribe medicines to kids who use marijuana chronically, and if so, which ones?
Yes, like we know that there's a correlation between kids who use marijuana and probably have an underlying psychiatric disorder, so it's absolutely appropriate to treat the underlying psychiatric disorder. Now, there is some correlation between marijuana use and not correlation, but marijuana use, what it does is sometimes it makes antidepressants not as effective. So sometimes you have to really figure out if somebody's not having an effective result from an antidepressant medication, whether it's because they're consuming marijuana with it, or whether you have to change the medication. Now, sedatives like Xanax, Klonopin, and kids who use marijuana sometimes are also consuming sedatives. So there's definitely an increased amount of sedativeness when you use cannabis, and you're also using so overdose is more likely possible with benzodiazepines. Having respiratory problems is more likely possible with when they're using marijuana and benzodiazepines at the same time. So you also, if you're prescribing benzodiazepine, you also have to be careful if they're using cannabis, because you will be prescribing much lower doses, and you will be very cautious about the combined effect.
That's fascinating. So if they're, say for instance, Klonopin, which is a benzodiazepine, you're your dosage would have to be a lot lower,
right,
because the cannabis
will enhance the effect of the sedative, sedatives. Yeah.
See, and that's also relevant for what the kids are doing outside of our offices, right? Because they're partying sometimes with Xanax, and so that combo, I'm sure they're not aware of.
And it increases, as we know, benzodiazepines suppress your respiratory center in your brain stem. So if you're using cannabis and they're going for a party and using, a lot of cannabis, you can actually have respiratory depression. And they sometimes combine opiates, which also do that. So you see this, it doubles, triples the risk of them having. So cannabis itself cannot suppress the respiratory center, but when you combine it with others, it enhances the effect of other substances and medications.
Fascinating. You guys have any questions for Dr. Mcdonald? She's the best psychiatrist in town.
So we've lived through this. My son's 17. He's been using it probably daily since he was 12. Can you do anything? Like, what do you do now? Can you change it?
Well, I think that what we have seen is the duration of use and high potency cannabis use has a significant, it's very significantly different whether you're using low potency or high potency, and the duration of use and how regular it is. So definitely you can, stop. If you stop it at a certain point, what they've seen is that you can actually restore some of the brain cells, or at least the white matter. So, if you educate them about that and show them that stopping the use and again, getting treatment for underlying problems, it's very common to see the correlation between underlying psychiatric diagnosis and use of anxiety disorder. It's very common. So what we see is that in the short term, sometimes anxiety is relieved in what we call immediate gratification they get, but in the long run, it actually can make withdrawal and anxiety worse. And people can also get paranoid. And some anxious kids are more prone to developing paranoia right away with cannabis.
So I guess the good news is you
can restore some brain functioning if you stop and also don't use the high potency cannabis, which means that you want to know where you're getting it, what is mixed with it, and be very careful with, I know that nowadays the medical marijuana becoming legal, there has been an increase in use of cannabis. And they're also mixing it with something called kratom, which is a herb that you get, kratom, K-R-A-T-O-M, which is available actually at the convenience stores. So in low doses, kratom works almost like a mild opiate. It kind of is sedating, but in high doses, it can actually cause agitation and even cause psychosis. And it's not regulated because DEA has not labeled it yet as a substance of abuse. So we're seeing that a lot of people are mixing kratom in the cannabis. So you get those two combinations, and you don't know what you're going to see.
So we've had adolescents come in with years of use, and some of them are psychotic. I mean, I think that's the only way to describe it, is they are psychotic. They don't see the world the way everyone else sees the world. And what we found is that if we can help them string together months, now I know it's hard, but if we can help them string together months, 1 month, 2 months, 3 months, they walk in and you're like, this is a different kid. And once they start to feel differently, they're seeing the world differently, they're less depressed, they're less anxious, they've now got a job, or they're now going to school, they have more hope. That can sometimes motivate them to get like a year in. And if you can get a year in, it can be a significant difference in recovery neurologically, a significant difference. But the problem is they got to have the accountability to be able to put in the time. There's a young man I'm thinking of. When I say he came in a mess, he was a mess. Like it was just almost weird. He had a weird social presentation. Super good-looking kid, but just couldn't really connect yet. And I met with him. And he's one of those guys where it just went well. You know, we just were able to kind of help him. And I saw him later. So he stayed with us in a program for maybe 3 months. He did outpatient for about another 6 or 9 months. So we got him about a year in. And then I saw him later out. It's a small town, right? So I think it was the Avenue or whatever. I see this kid walking through. He's like, oh my gosh, it's you. And when I say it was a different kid, it was just a different kid. I mean, he was relational and funny, and he had a good personality. It was wild, but it happened because it just has to clear, right? It just has to clear out of the brain.
So there's no specific medication for, cannabis addiction. What we do is we try to identify if there is an underlying psychiatric disorder and treat that. And then sometimes you can treat it symptomatically when they're trying to come off of the cannabis. So we use a lot of trazodone, which is a very safe antidepressant that we can use for sleep. It's shown to, in addiction hospitals and all, they use cannabis. Sometimes they can use a little bit of clonidine, which is actually a blood pressure medication, but it seems to calm what they call the autonomic nervous system down. So it helps them be more relaxed and be able to go through the withdrawal of the cannabis. Behavioral treatment is what is most effective in addiction. We know that, 12-step programs, IOPs. Unfortunately, there's no specific medication that can be very effective. Yeah.
So I have a question too. So chronic use, I mean, you can be addicted to that. Do they classify, though, marijuana or cannabis as it's not a controlled substance, right?
It is controlled
still
substance.
These days, even at the 95%.
It is still a controlled substance.
So that would actually be you could have a diagnosis of being.
Yes, it is. Yeah, it is a diagnosis. Yeah. In DSM-5, it is a diagnosis. Cannabis
that's what I
addiction
thought. Okay. So, and then sometimes you can have the anxiety before you get addicted to the marijuana. So, I mean, it just depends.
That's right.
You could be
In
predisposed.
girls, adolescent girls, once they achieve puberty, the estrogen seems to enhance the effect of cannabis both ways, positive and
7-Eleven, are they you buy
cannabis?
these
No. Cannabis is
no,
not
I know that.
Yeah.
I mean, like the vape pens and things like that. They sell their products
vapes
there
are
with the
available.
95.
Yeah. And then
And
you
that's
have
what they can use in school with the little pen.
Yeah, so what
they're
some
actually considered electronic dispensers, which
vaporize.
I've
seen them.
Yeah, they vaporize. So smoking is slightly different because smoking is you're increasing the temperature and you're actually burning something. Vaporizing is you're dissolving in liquid and then you are steaming it. So vaporizing is basically like steam.
Sure.
And smoke is, we're burning actually, right? So smoking cannabis can actually cause similar effects like cigarette smoking, because when you burn leaf at a very high temperature, it can release some carcinogens in tar, and it can, it's not as dangerous as cigarette smoking, but it can actually damage your lungs. Sure. Now, vaporizing is less dangerous because it doesn't burn the leaf it basically vaporizes the extract of the cannabis. But it also, vaporizing always goes to your brain very fast. Like when you eat edibles, it has to go through your stomach, it has to process through your liver. It takes time. But when you either smoke it or you use it in a vape, it crosses your blood-brain barrier and reaches your brain very fast. So it gives you a very immediate effect.
Okay. One more if everybody else has me.
Go ahead.
What about the oils and the things that you might find if you were perchance snooping through your child's room? Theoretically. And you found all these different types of vaping products. So they also have all these various small oil type things. That goes in addition to the vape, or that goes with the vape, or it varies?
So the oil itself could be what you're putting in the vaporizer or in the electronic cigarette,
so
right? So you have to fill the vaporizer with something, which then it vaporizes, right? So these oils are actually, it's because when you vaporize something, it disappears. Then you have to refill it, because these electronic cigarettes are battery operated. Or you can connect it to the USB and charge it.
Oh yes.
But you have to fill it all the time. So it depends on, some have larger capacity, some have smaller capacity, and they sell these nicotine vaporizers all over the place, and at 7-Eleven and all the convenience store, and then they mix additives in there to make them smell better, they make them taste better, like they have bubblegum flavored nicotine vapor, which when you vaporize it, it smells like bubblegum. And so what they think is that the nicotine vapors themselves are not as dangerous, because nicotine is more addictive rather than dangerous to your lungs, like cigarettes. But the additives they put in there to make them smell better or taste better are obviously, they are probably what is causing the lung damage that few cases we've heard of people who are vaporizing nicotine, not cannabis, are having lung damage. So it is from that additives, oils that are going and settling in the lungs and causing lung damage.
And the vapes can be the 95% as well.
Yes,
Absolutely, yeah. And then it's reaching your brain very, very quickly, because you're
that explains a lot.
Yeah.
Thank you.
All right, Dr. Madali, thank you so much for that information. It's awesome to have the medical piece here and for us to be able to have those questions answered. So thank you. All right, so we're setting the stage, right? And the goal is not to scare you guys. I know it's hard to hear some of this. We just want to be honest about the state of the situation that we're in, that we're faced culturally with. By the way, I ask kids all the time, what percentage of the kids in your school do you think smoke marijuana? All anecdotal, right? None of it is research-based. And I think it at least speaks to what the perception is of kids. And it's routinely 70%. I'm like, really? So 7 out of 10? It's got to be 7. They'll sit there and count their friends. And now, of course, they might have certain kinds of friends or whatever, but it's a big issue that everybody's dealing with. So what do we do about it? We really want to give you guys like some tools and tips on like what do you do to insulate your kid from getting involved in this, or to help your kid deal with it and recover from it. So, number one is education. So that's why we did this tonight, is because we've got to educate our kids on the reality of what's happening. They don't understand, guys. They don't understand what this is. They don't understand what it does. They believe it's healthy. We need to know that. They believe it's healthy. So they think it's natural. When I was a kid growing up in high school, it was routine for people to drink alcohol, right? More routine for people to drink alcohol than to smoke weed. If you were to go to any of the high schools around right now and interview the kids, you could say, do you drink? Oh, no, I just would never do that. People do crazy things when they're drunk, and it's, they have all this passion about why I would never drink. That's just gross. Do you smoke weed? Oh yeah, I smoke weed. They see it as different. They see it as harmless. So we've got to educate them. It's incumbent upon us as parents and teachers and educators and professionals to educate them on the reality of what's going on. It is a well-documented fact that when you educate young people on the dangers of drugs, use goes down. And I know that seems weird. It's like, that doesn't really work. It actually does. Smoking is an example. Less kids smoke today than have ever smoked in the past few decades. Why? Because we're pretty sure it's bad for us, right? And so we started to educate them. They gave away cigarettes to every soldier in World War II. They literally, please smoke more, because we didn't really have the data to support it. But now that it's overwhelming and we know how difficult it is for people in their health, the use goes down. We've got to lead the pack. It's those of us in this room, those of you online who are in a position of leadership with kids. We've got to lead the pack with education. Number two, we've got to communicate with our kids, and so it's got to be a different kind of communication, because this elicits a lot of escalation for many families. Even if your kid is not using marijuana, it still elicits a lot of escalation. Like parents just don't know how to respond. Billy's doing what? Your friend is smoking. Oh my gosh. Well, you can't hang out with him anymore, and we're blocking him on Snapchat, and we're moving. You know, we're going to do everything we have to do to, and it has to be a different kind of conversation. They're watching this every day at school. They're watching kids smoke. It doesn't feel scary or dangerous or overwhelming to them. It's scary and dangerous and overwhelming to us. We can't project that on them. It's got to be a laid back, breezier conversation where you're listening more than you're talking at first. Like you really just want to listen. It needs to be safe for them to talk. Like, hey, what do you think? Why are kids using? Are your friends smoking? What's the deal? What's the difference between the kids that smoke and the kids that don't? Ask questions and just allow yourself to be open to hear their real thoughts about it. Body language is important. Like the way, you know, if you're pacing and you're nervous every time the subject comes up, you're gonna shut them down. It's got to be like, just focus on. Now you might want to crawl out of your skin, but you're going to lean back in your chair and it's no big deal, because you've got to communicate that it's a safe topic. Your tone of voice is important. I had a buddy, he said so many times, he said, my dad treated me like an idiot when I was growing up. I was like, what do you mean? What did he say? Oh, he didn't say anything. It was the way he looked at me and the way he talked to me. His tone of voice was, you're so stupid. He said, I've made it a point, my goal as a dad is to make sure that I never talk to my kids in a way that make them feel like they're an idiot, like I'm condescending them. That's tone of voice. That's just, it's not even the words you're speaking, it's the way you're saying them. So once you start to communicate differently, you've got to keep communicating. Because some people will have it's like, well, I'm glad I had that conversation. That's over. So now we're done with that.
Like the birds and the bees.
Yeah, it's like the birds and the bees. Like, whew, glad that's over. It's an ongoing conversation. It fascinated me because I've had lots of parents say, well, I've already had the conversation. And their kid has been caught using. Well, no, you got it. Like, that conversation not done. You got to keep having it. You got to make sure that you're still curious, trying to understand what's going on. I want to talk to you just quickly about the judgment involved in a conversation. I'm sorry this is going out, guys. There we go. So as you're communicating, you really have to check your judgment. You want to approach these kids with grace and mercy, respect, and dignity. There's never been another generation in human history that has dealt with the challenges that this generation is dealing with. Never. They carry around thousands, millions of pornographic pictures in their pocket. Their friends know exactly where they're at all times on the Snapchat map. They have access to 500 TV stations, and they don't even watch TV because they have access to hundreds of millions of videos on YouTube. There's never been another generation of kids that have had this kind of pressure. There's never been another generation of parents that have had to figure out how to deal with it. So you got to watch your judgment towards them, give them tons of grace and mercy and respect and dignity, and watch your judgment towards yourself. This is hard. It's complicated. So there's one approach that I'll tell you guys about, and y'all can, we can talk about it later. You can look it up on the internet, motivational interviewing. So I'll tell you what motivational interviewing is. Motivational interviewing is basically it's a way of talking to someone that motivates the person who's talking, your kid, to pursue change on their own volition. Therapists use it all the time, right? So if I meet with a kid or a family and I say, okay, here's the deal. You just need to stop. Just stop using drugs, okay? Like, when we tell someone to do that, I remember when I was a kid, if someone told me to do that, like, don't drive fast on that road. Guess what I did? I drove fast on that road because it just felt good. If it had just a little bit of it, they want to do the opposite of what we tell them. Motivational interviewing takes the opposite tack. It says, I'm going to talk to you in such a way that I can put you in a position where you solve your own problems, where the ideas are yours, and where the healthy behaviors flow out of your own kind of heart. So the way you do that is you start with the idea that this is just a certainty in all situations, right? Adolescents are the most intelligent human beings ever created. Your kid is smarter than anyone ever created in human history. In their mind, that's how this works, right? They know everything. They know. So you want to try to treat them like the expert that they are, right? So how do you make sense of your goal to go to med? So you're going to go to med school. Let me make sure I get this right. You're going to med school, but you've got all C's and you've got a D in biology. Oh, yeah, I'm going to med school. Okay, that's good. I'm really glad the doctor's great in the family. I always thought, and you play dumb, I always thought you had to have decent grades to get into med school. I mean, everybody I ever knew that went to med school, they're pretty smart people. They got great grades. How do you plan on dealing with that? Like, because it's probably going to be tough to get in. And at some point, you keep asking those kinds of questions, and you sort of breach this point at which they've got to see the error of their logic. So in the context of addiction, it would be, so I understand that you're just not ready to give up marijuana. I get it. I'm hearing you loud and clear. But help me understand, like if you're not ready to make good choices with substances, how does it make sense that you keep your car? How do I know you're going to make good choices with a vehicle? Like help me get that. Now they've got to sit there and explain to you how it makes sense that they're going to be rational in one area and not rational in another area. They're going to have good judgment in one area and not good judgment in another area. And they can't. And it's your best path to be able to have a real conversation. Because at some point they're just going to say, well, it doesn't make sense, but I just want to. Well, that's a totally different conversation, right? Now you kind of have where you want them. Does that make sense? It's a difficult skill set because you really have to let it unfold, and you have to listen when you want to say, are you crazy? Look at everything you've lost. You're freaking never going out of this house again. You know, and it doesn't work, right? Because they're going to do the opposite of that. All right. Next, be honest about your personal history with drugs and alcohol. A lot of people don't want to talk about drugs or alcohol or any of this stuff because of stuff they know they did. So they're like, well, when I was in high school, I smoked weed every morning before class, so how could I possibly tell you? And you just can't go there, guys. We've all made mistakes. Every one of us has made mistakes. We've all been in situations that we shouldn't have been in. So to not be honest about that kind of just robs our kids from the opportunity to see authenticity in us. And it's only when they see authenticity in us that we're going to see authenticity in them. Does that make sense? So it's important for us to just own it. Like, yeah, I did. Now, you don't glorify it. So let's just be clear. You don't say, all right, we went out one night and it was crazy. It's not that. It's got to be, here's what I did. Here was kind of what it was like. Don't go into detail. Don't say, just vaguely like, yeah, I tried marijuana. Yeah, I did smoke a little bit. But focus on how you made the choice to stop. That's awesome. What awesome information for them to have from us, to the logic of when I finally got to a certain point, I was able to see this and this and this and this, and that's when I stopped. That gives them hope. That gives them hope that you made some mistakes and you walked through it. Maybe I can make these mistakes and maybe I'm going to be able to walk through it. All right, be honest. This gets a little difficult now. We got to practice what we preach. So you can't say, you know, the old adage, do as I say, not as I do. That doesn't work really well with kids because they learn from modeling. So really my only encouragement to you guys is to, right here, right now, going forward, what are you modeling with your kids? With especially marijuana use, but you can say, you know, drugs or alcohol or whatever. What are you modeling? Are you, and there's some people, you know, probably watching online where you're smoking marijuana and you're buying it from your buddy who gets it from the dispensary. You don't have a card for it. Yeah, those are the kinds of things that if we expect our kids to act in certain ways, when we're not willing to act in certain ways, it's unrealistic. It's just not, it's not gonna happen. They're not gonna learn from what we say near as much as they learn from what we do. It's been, like, that's one of the most base, that's the first class in psychology, right? It's like the first one, kids learn through modeling. And then what can you model? Is you model healthy living and you encourage healthy living in your kids. So beyond weed and whether or not they're smoking weed, are you teaching them how to exercise? Are you teaching them how to eat well? Are you teaching them how to take care of their body? Are you teaching them healthy habits? Do you have coping mechanisms to deal with your stuff, right? A lot of parents will be like, you know, in family therapy, he stressed me out so much, I had to get a glass of wine, you know? So you're demonstrating, I cope with my stress using wine. What is that? That's not a healthy coping skill. What is your healthy coping skill? What are you demonstrating to your kids about how you deal with your stress? That's super powerful. Because when they're thinking about quitting and they're thinking, then you can help them. Yeah, I tell you what I do is I run, or I take a walk, or I go walk on the beach, or whatever you're doing to manage your life in a healthy way. And then finally, if your child is struggling, so, you know, everything we've talked about is relevant for kids that have, or for parents that have kids that are struggling. It's relevant for parents that have kids that aren't struggling. But if your kid is struggling, you've got to get them the help that they need. And that's super hard to figure out how to do with everything going on in our world right now, and the state of mental health treatment. It's very, very difficult. So Alana, if you want to come bring us home here and kind of give us some ideas about what we need to do to help them get the help they need.
Okay. Do you want to take a break and get some water and cake and
We're a little late.
And hydrate? Well, you can do that while I'm talking. So please hydrate, nourish. So thank you, Dr. Mike. Thank you, Dr. Medali. I want to talk to you guys about number 8 and what that actually looks like. So I would like to start with kind of educating you guys about kind of understanding the different types of help out there and what that looks like structurally in our healthcare system. Because there's a lot and it can be confusing and overwhelming, and unfortunately there are some holes in the system. Now, I would say, fortunate enough to work alongside Dr. Mike to create a system that actually fills the gaps. And I'm going to kind of talk to you guys a little bit about that now. So I definitely want this to be a conversation, so if you guys have any questions or comments or experiences as I go along, please don't hesitate to just interrupt and jump in, okay? So the highest level of care is all the way to your left, so that means acute hospitalization. And what that looks like could be something like a Baker Act, a Marchman Act, a 72-hour psychiatric hold, and I actually missed one in there, but I'm going to add it. So that's kind of emergency behavioral health, right? Does anyone know anyone who has gone through a Baker Act or a Marchman Act? Okay, it's scary stuff. So that's kind of a behavioral health emergency, right? Now, what comes after that? Well, I can just kind of give some information about what that looks like for your child. So anyone up to the age of 18 can be involuntarily Baker Acted. Well, really anyone can be, but when it comes to kids, they don't have a whole lot of say on that, which is probably not a bad thing. But what that looks like could be something like acute psychosis as a result of ongoing substance use, of ongoing marijuana use, of a marijuana overdose is what we call it, right? So that can look like very erratic behavior, auditory or visual hallucinations, aggression, hostility, volatility, throwing things, hitting people, hitting things, hitting you, hitting themselves, hurting themselves or others. So that kind of all constitutes acute hospitalization, most imminent level of care. Does anybody have any questions on acute hospitalization?
Who can hospitalize children?
So great question. Dr. Medali asked, who can hospitalize a child? So a licensed mental health counselor can Baker Act a child, and they can do so by
psychologist, licensed clinical social worker.
Elements,
So in Florida, there are some rules that I think that.
I don't know how it is.
I think you have to be a licensed clinical social worker, an MD, PhD, or PsyD, or a police officer or law enforcement officer who has the ability to what they call initiate a Baker Act or an acute hospitalization.
And tell them where it's at. Where it's at and how do they get your kid there?
here?
In this area. Yeah.
Okay. So so where they go, just want to clarify. Okay, so who can Baker Act? So from my knowledge, a licensed behavioral professional, so LCSW, a PhD, PsyD. I've actually had LMHC's Baker Act before, but okay. Okay. And yes, and so a law enforcement professional as well, although that can be very traumatizing and scary. Any part of a Baker Act can be traumatizing for the child. It can also, in some instances, really be what that child needs. Unfortunately, we have some instances where some folks, unfortunately out there, just use a Baker Act as, I don't know what to do with this kid anymore, so I'm gonna have the cops figure it out. I don't know what to do with this kid anymore, so I'm gonna do whatever I need to do to get them in a hospital. Obviously,
And a judge can also order an acute hospitalization or a psychiatric hold. For parents, there's an opportunity, if you feel like they're not listening or they're not seeking help and you think they're in some kind of danger, you can request through the court system what we call a Marchman Act, which means you petition the court as a family member to say that my child is in danger, and then the judge can order what they call a psychiatric hold for 72 hours.
okay, so where they go? In Brevard County, we have got Circles of Care, which is a Baker Act facility for all ages. Not a lovely place to be. It's a little bit scary. It can be very frightening. So that's where.
So Gustav, or Rockledge Regional Center, has a behavioral unit, which is also a Baker Act facility. And now there's a Palm Point
Yes.
Behavioral Health, which is in Titusville, which is also a Baker Act facility, and it is a private hospital.
Yes.
But it's a 24-hour Baker Act facility. So they also have, all these places also have what they call intake services, which means that you can arrive there and the intake services can evaluate and decide whether somebody's can, you know, meet the criteria for acute hospitalization.
Any more questions on acute care? Okay, so what can come next, just depending on the person, would be a detox level of care. Now, an individual would have to meet medical criteria, or would have to meet criteria for a medical detox in order to be admitted to a detox unit of a hospital or a detox center itself. Unfortunately, there is no protocol right now, makes me so mad, for a marijuana detox, because while there are and can be withdrawal symptoms, it's not quite at the point where there is a medical protocol to detox an adolescent, or really anybody, off of marijuana, which makes it a little bit harder. Now, what I have seen, I have been dealing with adolescents that struggle with any kind of substance use, addiction, marijuana use, problematic behavior for 12 years now. And what I have seen over the years is the frequency of an adolescent ages, it used to be about 15 to 18. Now it's about age 11 to 18 that they're starting to develop these sort of socially addictive behaviors that Dr. Mike was talking about earlier. All of that to say, what I've seen is it is so common for an adolescent to be also using another substance while they are using marijuana. It is highly unlikely, I don't have actual statistics, I'm just talking about my 12 years of professional experience. It's highly unlikely right now that a teenager who is smoking or vaping marijuana or cannabis it's highly unlikely that they're not also drinking, smoking other things, doing other drugs, on downers, on uppers, sedatives, opiates. Now, there's a lot less cocaine use recently in kids, but now sometimes what we're finding is the marijuana that they're smoking is laced with cocaine, is laced with PCP, is laced with amphetamines and methamphetamines and ketamine and all these things that create or magnify the kind of psychotic effect that excessive marijuana use can already have all by itself. All of that to say, so sometimes in some cases with that concurrent use, that individual can qualify for a medical detox. It just wouldn't technically be from the marijuana itself. Any questions on that part? Okay. I'm gonna kind of try to breeze through the rest of these. So inpatient residential is what comes next. This is typically a 21 to 28 day in-house program that the child is usually at on-site. So they're receiving kind of 24/7 care at that point. That is the highest level of care that is not considered emergency care out there. And luckily we kind of work as I work as a treatment liaison with trusted professionals in the community. If one of your children need a level of care, or to even identify what level of care they need, I'm your girl. So assessing for what they need of all of these is one of my specialties. Inpatient residential can be very helpful, especially if there is a co-occurring mental health issue, which, as you've heard from our doctors today, is pretty prominent. Whether it's the chicken or the egg, it's very difficult to know when we have our teenagers, because does the anxiety cause the marijuana use? Are they self-medicating the anxiety? Or is the marijuana use causing them to be jittery and agitated and look like anxiety? Or is it both? It's very difficult to tell. But those co-occurring disorders can be treated very well at a residential program. The one step down from that, so this is in order, right? So one step down from that is a PHP program. When you hear the term PHP being thrown around, what that means is partial hospitalization. And essentially what that looks like, that can be an on-site or an off-site location, treatment facility, that is typically 5 hours per day, 5 days per week of clinical programming, including behavioral and medical health care for that child. Almost all of these can work with insurance. Almost all. Go ahead, Lori.
Sure, thanks. Just speaking, so the inpatient and residential, though, that can vary to, let's say 11 days before you get moved to PHP.
That's true. And that is, yeah, that's a very good point. And that definitely is one of those things that solely depends on insurance. We have a lot of kids that their parents would prefer to private pay for them to go to a residential to get and that's one of the holes in our healthcare system, right?
Sure.
You know, is that insurance isn't seeing the child, they're seeing documentation on the child, and they're making a decision to then determine, how long does this child need? Based off of this, what's on black and white. Again, it's one of the holes in the healthcare system where we try to fill the gaps with that with some of our programs. But yes, absolutely.
Yeah, that's where the question came over
so
that
the Baker Act law
diagnosis.
says, the Baker Act law says that it's 72-hour hold, which means that at the end of 72 hours, they can keep them up to 72 hours. Now they can release them before then, so it's considered a crisis hospitalization. And after 72 hours, the doctor or the clinician has to certify that they require longer hospitalization. And again, that also depends on, of course, the clinician who is examining the child.
Sure, I mean, I'm sure it's difficult in an inpatient residential because they don't really know the person
and
that's
residential
there.
is considered a lower level of treatments, and usually residential treatment centers are not locked. Baker Act facilities locked, you cannot leave. It's involuntary. Usually hospitalizations occur at what they call Baker Act facilities, which are inpatient crisis units.
My favorite. Intensive outpatient program. What we find in research shows that our teens heal in community. The IOP, or the intensive outpatient program, is technically the second lowest level of care, but actually the most effective level of care for our teenagers that are struggling with any kind of addiction or mental health or behavioral issue. Why? Because this is approximately 3 hours per day, 3 days a week at minimum. And it looks at the whole person. So mind, body, soul, spirit. Physically, mentally, emotionally, socially, how is this child doing? What do they need? An intensive outpatient program, which we offer at LiveWell Behaioral Health, at our other office over on US 1. What that does is, again, it treats the individual both behaviorally and medically simultaneously, while they're able to maintain their schedule, being in school, potentially being in extracurriculars, while they're still out there in the world doing their thing, and we're working on their insides and healing them from the inside out. So intensive outpatient programming can be anywhere from 8 to 12 weeks. Average is about 8 to 10 weeks. What we're finding is some of our kids who are so resistant to coming in because they're petrified of a group session, is we are finding that after month 1, after month 2, can I please stay 1 more month? I love this so much. I've made friends here. I'm feeling better. And again, like, just in this last week, we've had so much success just seeing these kids get better. We have a lot of kids now with social anxiety. I say now just because, not that it hasn't been there before, it's just that we have more tools in education now to evaluate social anxiety at this point. So what we've done is I've created a group specifically for kids with social anxiety, so they're with others that struggle with social anxiety, and the provider is specifically working on helping them develop healthier social skills. And what that does is, again, like it just specifically tailors, what we do is we tailor the needs of the child to get better. And we can do that at LiveWell with our IOP. What questions do you have about IOP, intensive outpatient? All right, and then last but not least is outpatient. Both of these are outpatient, but when we talk about OP, we're mostly talking about kind of that 1 or 2 hour per week of either psychiatric care or therapy per week. So it's about 1 hour or 2 per week. And an individual, one of your teams, they can go through all levels of care and step all the way down and come out a whole different